We can't talk about the cardiovascular system in the heart without talking about heart attacks. So, heart attacks is actually not a medical term, but when people say heart attack, generally what they mean is that one of the coronary arteries that should have been carrying lovely oxygenated blood down to the muscle tissue of the heart, one of those coronary arteries got clogged. And very often we think of this clog as kind of being like a clog in a drain that got backed up. It's only a little bit like that, but the idea is that whatever is blocking that tube, blood carrying oxygen, can no longer get down to the muscle. And when muscle tissue doesn't have oxygen, it's unhappy. And at first, it'll make a lot of lactic acid, and that lactic acid burns and causes pain. And that's what we're experiencing as a heart attack. But when it goes on longer, those cells die, and then it doesn't hurt. And that's even worse. So, why would you get a clog in your heart? Let's start by looking here at a very healthy coronary artery. Do you see this sort of curly Q kind of look of the inside of the artery? And then we've got that old fashioned phone cord look of this outer part of the artery. And then all of this area that's white here in the center, that's where blood would go through. Actually, when this artery was in a healthy person, it was able to stretch out really big because there was blood pressure inside of it that was like straightening out all of these lines. And you had a ton of blood going through it. So let's imagine that this coronary artery was able to carry blood kind of like a milkshake straw. You know, milkshake straws are a little fatter than regular straws. Now, let's look here. This is a coronary artery that was removed from someone who had a heart attack. And I want to make a couple of points. One thing is, even when the blood pressure was quite high, instead of a milkshake straw, this was more like a little coffee stirrer, all right? Instead of getting a whole bunch of blood down the tube, there would only be a little bit of blood getting down the tube. Before a heart attack happens, sometimes people will experience temporary pains in their hearts, like when they exercise or go up the stairs and they'll get a pain in their heart. And if they sit down, oh, it goes away. That temporary pain is caused by an artery that looks like this. And the temporary pain happens because the artery is not completely blocked, but it's no longer letting in big gulps of blood like the milkshake straw. It's letting in little drops of blood like coming out of a coffee stirrer kind of thing. But when another point that I want to make is that it's an obstruction of a coronary artery is not exactly like a blocked pipe in your house. A blocked pipe in your house, you can put in a tool and you can kind of roto-rooter it out. We actually do have tools like that we could use in a coronary artery problem, except that's not where the fat is building up. You know, I usually thought, back before I knew more about this, I kind of thought that glumps of fat were just kind of like, ooh, there's a glump of fat, and here's going to be a glump of fat. And now I've got all these glumps of fat, and then the glumps of fat kind of. Now, if it were like that, then yes, we could just go in, we could suck it out. But that's not where it is. The fat is actually being put here. The fat's being put down in there. It's being put underneath the surface of the artery. So the anterior surface of the artery is still there. It's this stuff in here, this stuff in here, that's where all the fat is. So you can't just scoop it out, right? Now, how did it get there? This problem in the artery is called atherosclerosis. Atherosclerosis is this buildup of fat and what gets known as plaque in the walls of our artery, and we can't just scoop it away. Atherosclerosis does not just happen in the arteries of your heart. It can also happen in the arteries taking blood to your brain. And when those arteries get obstructed, you get a different kind of stroke. And also, when those arteries get obstructed, you don't think as well as you used to when you were younger and healthier. But more than that, You can tell your Uncle Joe, who doesn't take care of his heart, that all of his arteries are doing this, including the arteries that blood to his legs, and they're going to start to make his calves feel like they're on fire when he walks even a little bit. Also, atherosclerosis, this kind of change in arteries, is the number one cause of impotence in men. Men need an artery to send blood to their favorite part of their body. If the artery going to a man's favorite body part looks like this one here, you ain't getting enough artery in there to make Aunt Rose happy, right? So Uncle Joe may not care if he suddenly dies, but he might care if he can't keep the love of his life happy. So atherosclerosis does not happen just in the arteries of the heart. It happens everywhere in the body. Okay? Now, what is causing this? Okay, first of all, we don't actually know all the things that are causing this, but we do know that a diet that is high in saturated fat, particularly animal fat, like full fat steaks and full fat hamburger and dairy products, that leads to an increase in atherosclerosis, particularly when people have got high blood cholesterol levels. They're more likely to get atherosclerosis. People with diabetes mellitus, sugar diabetes, are twice as likely to get atherosclerosis. Okay? Yeah, that's not a healthy artery. Okay, heart attacks. So a heart attack would happen if, say, this little coronary artery right here, ooh, let me change the color of the pen. This little coronary artery right here, it is finally completely obstructed. So now the blood gets this far and doesn't get any farther. And then all of this part of the heart is like, I'm so sad, I'm getting no oxygen, I'm getting no glucose. And so then it starts making lactic acid. That hurts, that causes some of the symptoms of a heart attack. And then it starts to die. And when your heart muscle cell dies, it does not come back to life. We do not yet have a way to regenerate someone's heart. So then you die. Okay, I want you to know the signs of a heart attack. First, let's talk about the traditional signs of a heart attack. A heart attack that we're discussing is called a myocardial infarction, or the cool kids call it an MI, myocardial infarction. And most men will have severe chest pain and like a crushing weight on their chest. Very often the pain will radiate down the left arm. Not always, but very often. Sometimes people will feel like they can't catch their breath. They will be sweating and nauseated. They'll feel like they need to throw up, and they'll be super, super tired, okay? Those are the traditional symptoms, and most of us would recognize that. If that's happening, then the person, unless there's a medical reason for them not to do so, that person should chew a couple of regular strength aspirin, and you got to call 911 and get that person to the hospital as soon as possible, okay? But I want to tell you that there are atypical signs of a heart attack, and women that have a heart attack are more likely to not have these symptoms. They are more likely to have the atypical ones. What are the atypical ones? The atypical ones are profound tiredness, super bad tiredness. Like if you go to visit your grandma, and instead of jumping up to cook you stuff and make you eat, instead of doing that, I just can't get up. I'm just too tired, right? Also, if she has got pain along with that in her neck or her jaw or even her upper shoulder, that it can also be signs of a heart attack. And then sweating and being nauseated. So you can imagine that you go over to visit your grandma and she thinks she's just coming back down with the stomach flu. She's sweating, she's nauseated, she doesn't have a fever, but she's super tired and she thinks she slept on her neck wrong. That could be signs of a heart attack. And so again, unless there's a medical reason for her not to take aspirin, and there might be, it's helpful to chew a couple of aspirin and then call 911 and get her to the hospital. All right. Last little bit, let's talk. Let me remind you that the blood pressure is so low in your veins, even the vena cava, that there's not enough oomph to get it back up the body. Just there's not enough pressure there. So the heart sends blood to all of the capillary beds, but coming back, it's on its own. And how does it work? Remember that like lymphatic vessels, the veins have got valves. And since the veins have valves, one-way doors, that means that when this part of the vein gets squeezed because your muscle just contracted, then that squeezing will cause blood to go up through the valve. And then when it tries to come back down, it'll get trapped here. And when it gets trapped here, it can't go back down, right? And then the next time, this area will get squeezed and the blood will go up to the next little segment. That squeezing generally happens in veins because of the skeletal muscle pump, right? The thoracic pump is when you take a deep inhale, you are pulling blood up into the thoracic cavity, and it'll go up a few little steps. And then when you exhale, it wants to go back down, but it can't go all the way back down to your feet because of the valves. One more thing. Please remember that gravity also moves blood back to the heart. Let's change this particular side so I can add that. Gravity. Oh, it's not working. I'll just write it in. Gravity. Now, gravity works against your body when it comes to, nope, that didn't work. Gravity works against your body when it comes to your legs, but it's mostly gravity that is bringing the venous blood from your head down to your heart, okay? So blood returns to the heart by the skeletal muscle pump, the thoracic pump. Don't forget gravity. And we are done with the cardiovascular system. I think this is our last topic for exam 3. Better double check the study guide before you follow my advice on that. And we are going to call it a day.